Yeah, class, today we are going to talk about anemia. Anemia, this is a British word derived from a Greek word. The Greek word is Anaemia. These Greek people, they joined the two words, ana and haemia. Now, haemia means blood, and an means lack of or no or deficiency of. So, an and haemia. So they just removed this one and they joined this one. So actually, for them they write like this. They put I. So this is how we came with the word anemia, meaning lack of blood or no blood or deficiency of blood. And here we are dealing with particularly red blood cells. This is the type of the blood which we are interested in when we talk of anemia. Majorly, we are interested in red blood cells. Now, with anemia, it must be below a certain level of measurement. Because we measure, we quantify and say that this person is anemic or not anemic. How do we do it? We shall see that later. So, to consider an infant, to be anemic, it must be less than 14.0 grams per deciliter. That's, you get me, class? So, this is an infant, 6 months up to 4 years. This one, we consider this person to be anemic once is below 11.0 grams per deciliter. If it's below this, we say is anemic. So 5 years to 11 years. These ones are considered to be anemic when the HB drops below 11.5 grams per deciliter. Then from 12 years to 14 years, they are considered to be anemic if the HB drops below 12.0 grams per deciliter. Now from here we go to adults. So non-pregnant woman, is considered to be anemic if it is below 12.0 grams per deciliter. Then the one who is pregnant is considered anemic if the HB goes below 11.0 grams per deciliter. Then a mature man and the adolescents. These ones are considered to be anemic if the HB is below 13.0 grams per deciliter. So for these respective ages, HB must be as stipulated here. If it must not be less than these figures as stipulated here. So let us continue and see the risk groups, the groups which are mostly at risk. These are the children 10 years and below. Then we have the pregnant mothers. Then we have also elderly people. Actually, here they say in the research that it becomes worse. Actually, that in fact 10% of the people who get anemia, they are above 65. They are 65 years and above. The 20%, they are in 85 years and above. 85 years and above. So elderly people are also at risk of getting anemia. Then we look at also, we have those people with chronic diseases. Chronic diseases like the ones with the sickle cell diseases, they are at risk of getting anemia. The ones with the thalassemia, they are at risk of getting these diseases. We have those people with the TB. We have those people with AIDS, stroke, HIV. We have leukemia. There are many diseases. And we shall talk one by one in the future. There and the others, we have already talked about them in our previous videos. So you need to check in our previous videos on this YouTube channel, on our YouTube channel of this school. So these are the people at risk of getting anemia. Even the people who get accidents, majorly fatal accidents or deadly accidents, people are most likely to get anemia, and so many people, but these are the ones we have managed to give you here. So with anemia, which lab tests are we supposed to do with anemia? One of the lab tests we have to do, we have solubility test. Test for sickle cell disease. Here you want to see the cause of anemia. Could it be sickle cell? So you do this test. Then we look at the slide. We make a smear examination. So you get a slide and make a smear, stain with Romanesque staining, then examine that slide. Then another thing, you can see whether the person is anemic by doing HB quantification. Here you can use the study hemoglobinometer, a hemochu, like that. You can also red blood cell full count. and many other tests, but majorly these are the ones we have managed to list here, actually, which are most common ones. Because with the sickle cell, it continues with the confirmatory, where you use electrophoresis. But usually we do the majorly here. We usually do this hemoglobin. We usually do this hemoglobin quantification. This one here. We want to see how much hemoglobin do you have. So if the lower the hemoglobin, the lower the red blood cells. The higher the hemoglobin, the higher the red blood cells, most likely. Classification of anemia. We can classify anemia in so many ways, but this time let us first classify it etiologically. So we are classifying etiologically. Etiologic classification. Now, etiologic classification, we are classifying etiologically here. So we are classifying according to the cause of the problem, anemia. So the classification number one, we shall talk of the blood loss. Maybe you just lost the blood loss. Then there is another way of classifying. You might have not just lost the blood, but maybe it was not manufactured. So that is impairment. Impairment in blood formation. This is a problem. The problem might be in the store, in the factory where the blood is being manufactured. So impairment in blood formation. So the problem might be where the blood is supposed to come from. Then another way we can classify anemia. There is hemolytic anemia. Hemolytic anemia. Blood might be being formed very well, but being raised or broken down. It might be being manufactured very well. It is formed, it comes to the saturation, but when it is in that peripheral blood saturating, it gets a problem of what? Of being broken down. That is what we are calling hemolytic anemia. Actually, hemolytic comes from hemolysis. Hemolysis is the breakdown of the cells, the blood cells, the red blood cells. Once they are hemolyzed, that is hemolysis. Now here, in blood loss, this one has two. Here in blood loss, it can be acute blood loss or chronic blood loss. So it is acute blood loss or chronic blood loss. Then impairment in the blood formation. This one can be caused by various diseases. So diseases here which can cause this can be, we have pernicious anemia. Pernicious anemia. We have sideroblastic anemia. We have megaloblastic anemia. Megaloblastic anemia. We have iron deficiency anemia. We have, these are the ones we have: pernicious anemia, sideroblastic anemia, megaloblastic anemia, and deficiency anemia. Then also if there is a problem with the kidney disease, kidney disease anemia also follows here. Kidney deficiency anemia. There are many which goes under here. Then under hemolytic anemia, here hemolytic anemia we have, yes, okay, so under hemolytic anemia, here we have acquired immune anemia. Then we have also non-acquired immune. And we have also hereditary hemolytic anemia. Hereditary hemolytic. Then we have also non-hereditary hemolytic anemia. Then blood may come very well. It is not hemolyzed, but itself it has the membrane which is not fine. So red blood cell membrane, defects. Red blood cell membrane defects. Then there is hemoglobin abnormal hemoglobin also is a problem. So these are some of what we can talk about for now about the classification. So let us start tackling one by one. Blood loss. Let us start with blood loss anemia. Blood loss anemia as a topic on its own. So now here, this can be either acute or chronic. Let us look at acute. Acute loss of blood means that volume or you lose a big volume of blood within a short period of time. a short period of time. You lose a big volume of blood within a short period of time. That is what we are terming as acute blood loss anemia. The signs and symptoms. The signs and symptoms. The signs and symptoms of somebody who has got acute anemia. So if you have lost like a 25 to like a 30% of your blood, usually you'll have slight headache. Slight headache. You will also start seeing that there is a rapid heartbeat. Also, there is hypotension. When you lose like 31 to 40% of your blood, you will see that somebody will start sweating. You get me? Okay. So shortness of the breath. So you start sweating, then you get shortness of the breath, then you'll also get decreased. There is decreased blood pressure. Then also there is weak pulse rate. You get me? Then also there will be loss of consciousness. Then last we shall talk of what you can experience here. The urine volume will reduce. Will decrease of the urine volume. Then when you lose like 41 to like 50%, you find that here you will just go into shock. So some of these ones, some of these signs, they start smaller, they go on increasing the worseness, and also they will be adding on more other signs. Because here you didn't have the consciousness, but here you just went into shock. So let us tackle the next part. Causes of this acute anemia. The causes. Cause number one, there is road traffic accidents. RTA. There is road traffic accidents. When you get accidents, you lose a lot of blood. This is the type of anemia you get. Then there is ectopic pregnancies. And here there is also surgery, because it may lead to surgery. And if they are not so much. So when you are going for surgery, make sure that you know how much blood the patient has, such that it will give you and understanding that maybe this patient might become anemic if I go on and just cut. So you have to know how you now know I will have to prepare to book for him or her some blood somewhere as you are going for surgery. Then heavy menstruation periods. If you get this heavy menstrual period, you will get this acute anemia. Also, there are things like in the maternity there is APH, stroke PPH. They can still cause this. So what you know that this you have actually this one you just have to note. It is a note now which you have to note. Laboratory findings here, some of them lie when you get a patient with acute anemia. Some laboratory tests will lie. You'll find that if you do HB quantification test, if you want to see the amount of hemoglobin in this patient, or you check for the PCV, packed cell volume test, or packed corpus volume, you'll find that they are normal. But when you look at the patient, is almost dying. So this test will change to abnormal after like 3 to 4 hours. After like 3 to 4 hours, because at this time, at first the HB and the PCV, they are normal. Why is it? Because there is constriction in the vessels, the blood vessels, or vasoconstriction in the vessels. But after like 3 to 4 hours, the body will realize that I have lost a certain volume of blood, and there is no way of replacing this very fast. So what the body does, it will to release the fluids to enter into the blood vessels. And when they enter into the blood vessels, you find that they will dilute the blood which is there in the body. They will dilute the blood cells which are there in the blood vessels. Hence, lowering hemoglobin concentration, or it will kill the hemoglobin concentration. Hence, even the PCV will start lowering. So you can take this HB immediately once the patient arrives at the facility, but make sure that this type of anemia, if somebody has just got like an accident or surgery or what, or heavy menstruation period has attacked the person, or APH or PPH has come, those ones who are working in the maternity ward, make sure that you also do a test after some time, like 3 to 4 hours, to make sure that you get the real picture. So if the HB is normal for somebody who has bled too much, just know that you have got those normal results, but according to the way you have seen the bleeding, you have the doctor in most cases has to recommend a transfusion. So here, the hemoglobin. So now, because at the end of these 3 and 4 hours, the HB and the PCV will now lower. And after the HB lowering, you just the platelets the platelets and the white blood cells for them will elevate, they will shoot. So that's the what comes in after the 3 to 4 hours. These ones instead shoot, the other ones they lower. So when you're in the lab, when you go to the lab and try to see the findings, the more findings now in the sample of this of such a patient with acute anemia, what do you find? You find that in the slide you will see normocytic, normochromic. When you look at the appearance in the slide, you will see that everything is normal. The size of the cell will be normal, and the staining of the slide or of the cells will be normal on the slides. Then you will see that there is, when you check on the white blood cells, you see that there is shift to the left. There will be shifting to the left. When we say shift to the left, it means there is appearance of, let's say young, let's use young. There is appearance of young white blood cells in the peripheral blood. They shift to the left of white blood cells. Then also there is slight poikilocytosis and anisocytosis. Poikilocytosis and anisocytosis. Then also there is large polychromatic red blood cells. Then also we can see that most of the hematological indices, are normal. Most of the hematological indices are normal. Like now the PCV is normal, then the HB is normal, then later slightly after 3 hours it slightly goes down. Then the reticulocytes appear in peripheral blood after like 6 to 12 hours. Chronic blood loss anemia. So here, as in definition, this is loss of a small amount of blood over a long period of time. Actually, here, what also comes in is that since you are losing blood on and on, one of the materials which we use to make blood is the iron. So you'll find that here you develop high chances of developing iron deficiency anemia. Anemia. As the iron stores get depleted, they get depleted over a long period of time. So causes of this chronic blood loss anemia. What causes this chronic blood loss anemia? There is one of them is menorrhagia. One of them is menorrhagia. This is chronic vaginal bleeding. This is menorrhagia, chronic vaginal bleeding. Then there is chronic, also there is chronic rectal bleeding. There is a chronic bleeding ulcers. Then also there are some parasites. For example, we have the trichuria. There is another parasite also, which we call, you can have cystosome. We have schistosomiasis infection. Also we have what we call the hookworm infection. So we are looking at the chronic blood loss anemia lab findings. So what you can find in the what? In what you can find out in the lab. So when you go to the lab, in this case, you will find that the white blood cells will be low. White blood cells will be low. Then reticulocytes are low. Then initially when you look at the slide on the smear stained with the Romanesque stains, you find that initially at the start of the bleeding, it was normocytic, and normochromic. But later it becomes microcytic. It later becomes microcytic hypochromic. That is the appearance of the red blood cells in the slide of somebody who has got chronic blood loss anemia. What you find in our findings in the lab. Then, when in that slide also, you find that the red blood cells, they have polychromatic appearance. That's what you find in the lab. So that is it for today. We are continuing. We are going to look at so many types of anemia. I have iron deficiency anemia. We are going to look at it in our next video. So just subscribe, because if you subscribe, that makes it easy for you to access our work wherever we load. So just go to the YouTube channel, search for, type Dr. PCM medical lessons. Type in this word. There is no dot here. It is Dr. PCM medical lessons. Then on this side there is a smaller word there written subscribe. Place a finger in it. Then when you touch there the second time, it will bring the word up with so many words, but there is a word up which reads like all. Pressing that all. There you have subscribed, and you have now booked us that in case of any other valuable video like this, you will be able to see that video. Thank you for your attention till the end of this video. Stay with me by subscribing. I thank all those people who have already subscribed to our channel. Thank you very much.